What I'm going to show you today is how to do paced bottle feeding. Paced bottle feeding is a method of bottle feeding a baby that is designed to more closely mimic breastfeeding. And it allows the baby to pace the feed and control how much milk they take. And I like to compare it to if you've ever been out to lunch with a good friend and found yourself chatting throughout the whole lunch and realized at the end of lunch you've only eaten half of your sandwich, but you're full. And compare that to maybe if you've ever at another time been really, really hungry and sat down to eat and eaten really quickly and realized by the time you were finished that you were actually more full than is comfortable. So paced bottle feeding is designed to mimic the conversation of breastfeeding, a little bit like going out to lunch with friends. So how you do it, there's a couple of steps to it. Rather than holding the baby flat and just putting the bottle in their mouth, like we often think of for bottle feeding, you're going to hold the baby a little bit more upright. However is comfortable for you and for the baby, and so you can look at each other, but the baby's not going to be flat on their back. They're going to be maybe 45-degree angle or even a little more upright. Then what you're going to do is use the bottle, and this is going to be a bit like breastfeeding, to tickle the baby's upper lip here, and the baby should then reach up and latch onto the bottle. Then what you need to do is encourage the bottle to be pretty far into the baby's mouth and encourage the baby's lips to flange and relax around the outside of the bottle so that they're a little bit turned out around the bottle. And then what you do, rather than tip the bottle up like this, is you're going to hold the bottle horizontal like this. Some folks worry that the baby will get a little bit of air during a feeding like this, and usually burping will just take care of that, so it's not a big deal. So when you've got the baby latched onto the bottle like this and the bottle horizontal, the baby will normally begin to drink milk from the bottle. Then what you do is you allow the baby to drink for about 20 to 30 seconds, and then you pull the bottle down but leave the nipple in the baby's mouth. And what you do is you wait until the baby begins to suck on the bottle nipple again. And when the baby begins to suck, you lift the bottle up to horizontal again. Give it another 20 or 30 seconds, and then pull the bottle down again without pulling it out. And again, wait for the baby to re-engage with the bottle and start sucking again. So you'll be going back and forth and back and forth, up for 30 seconds and then down until the baby sucks again, and so on. At some point, you'll pull the bottle down, and the baby, usually what will happen is the baby won't start sucking again, even if you wait quite a while. So what you'll do then is just end the feeding. And so it can be tempting if there's just a small amount left in the bottle to just convince the baby to take it, but you need to respect the same way a breastfeeding mother would a baby that doesn't want any more, that the baby's feeding is finished. So there are a couple of reasons we do paced bottle feeding. One is because often when babies begin childcare and start having frequent bottles at daycare, if babies are not experiencing paced bottle feeding but are experiencing a great big bottle going in really quick, a lot of babies enjoy the convenience of the fast flow and the shorter time it takes to feed and start rejecting the breast at home. So this paced bottle feeding can keep them more feeding by their normal pattern. Another reason to do the paced bottle feeding is for childcare providers, because breastfeeding mothers will normally be sending a certain amount of milk to daycare each day, and if a childcare provider isn't doing paced bottle feeding, the baby may go through almost all of the milk in 1 or 2 feedings by the regular method. But by paced bottle feeding, a baby will typically take 2 to 3 ounces and not really much more. So the baby will need to be fed on more of a breastfeeding schedule every 2 to 3 hours, but will take the normal amount of milk, so the milk the breastfeeding mother sends should last throughout the day. And then the last reason, which is pretty interesting, is that a study came out recently comparing babies who are being bottle fed and babies who are being breastfed. And in the bottles was either formula or breast milk, and then of course the babies who are breastfeeding were getting only breast milk. And they found that the babies who were bottle feeding, no matter what was in the bottle, breast milk or formula, had a higher risk for obesity at a year of age compared to babies who were being fed at the breast. And one of the theories is that by being fed this way and getting larger feedings, babies get that sensation of being over full and learn to associate that with just fullness, and they begin to think that they need to be that full in order to feel satisfied. So paced bottle feeding can keep babies used to keeping their feedings at a more normal size, 2 to 3 to maybe 4 ounces per feeding, and hopefully prevent the risk of obesity that can go along with bottle feeding. So that is paced bottle feeding, how to do it, and reasons for it.